At Dr. Sellars Educate, we help nurse educators and leaders advance their skills, pass the certification exam, and achieve excellence in nursing. Whether you're preparing for the CNE, CHSE, or CNML exam, our coaching programs, masterclasses, and study resources are designed to help you succeed with confidence. We provide a NCC-accredited continuing education, faculty development workshops, and practical strategies to strengthen teaching excellence, simulation, curriculum design, and accreditation readiness. We partner with schools of nursing and healthcare organizations to support faculty development, certification initiatives, accreditation preparation, and educational excellence. More than 5,000 educators have trusted Dr. Sellars Educate to support their professional growth and certification journey. Visit us to learn more and join a community committed to excellence.
Most nurse educators feel like they're creating an inclusive learning environment. But inclusion is not just about who's in the classroom. It is about who feels like they belong. Who is actually learning? Who is participating in the discussions in these great learning activities and strategies that we've developed for the classroom? This is exactly what we will be exploring in our conversation today. What are those evidence-based teaching strategies that create this inclusive learning environment where all students are participating, all students feel like they belong, and all students are actively learning? Welcome back, everybody, to Dr. Sellars Educate, where our mission is to support all nurses, all nurse educator colleagues on that journey to achieve excellence. So if you haven't already, go ahead and print out that study worksheet. It's listed right here in the description. We want you to write down today's date, whatever date you're watching this snapshot, and also what is one takeaway that you want to leave with? Perhaps it is having more knowledge about what cultural competency is all about, how to create these inclusive learning experiences for our students so all students feel like they belong. Or maybe you're just here to hear the definition of cultural competency and figure out how it correlates with the teaching strategies that you're developing for your learning environment. We also are going to be talking about specifically what are those next steps to ensure that you are on the right path, on the right track to do everything that you can as the educator to help our students learn. Let's take a look at our motivation and devotion for our time together today. Great educators never stop learning. When you model curiosity and growth, your students will follow. Lifelong learning is not just about staying current, it's about staying passionate. And that is from our devotional that is exclusively for nurse educators, titled Rooted in Wisdom. And that's also in the description as part of a link that you can access if you're interested in learning more about our devotional. Cultural competence. I want you to think about right now, what word comes to mind? Or what do you think that looks like when we say cultural competence? And inclusive learning. So what is that correlation between cultural competence? How is it even defined? And how do I know if I'm culturally competent or not? And inclusive learning. Our ability to truly engage students on this journey to learn, to have deep knowledge as it relates to their ability to make safe patient care decisions is really the goal that we have for our students. We don't want students to feel like they're an outsider. We want them to be open and receptive to the content that we discuss in class, and that's going to require them to be actively engaged in the conversations that we're having. So that's where we're going to start in this conversation. What is cultural knowledge? Okay, so let's just talk about a few of the definitions or considerations that you want to think about. First and foremost is going to be Billings and Halstead. We want you to turn to page 307 as it relates to what cultural knowledge is. Okay, so that's where you're going to start. We're still in the 6th edition. The next page we want you to focus on is going to be the assessment. Okay, so this is on page 309, table 17.2. There are key areas that you want to ask yourself questions about that you will see in box 17.2, but I'm going to name a few. First and foremost is awareness. So a specific question could be, am I aware of my personal biases, stereotypes, and prejudices toward cultures that are different from my own? To what extent am I aware? Am I aware that a limited English proficiency does not equate to ignorance or low intellectual capacity. As you're thinking about resources that you're going to use to help you really have a deeper understanding of the content that we're going to talk about today, it starts with doing an assessment. So using page 309 in the 6th edition, or there may be a different tool that you're used to using. The key step on this journey is making sure we have that increased awareness of where our gaps are, where our stereotypes, how our stereotypes show up, how our biases show up, and how they can directly negatively affect the student's learning experience. What if students not participating is more about how they feel when they come into our classroom than about the actual teaching strategies that we spend so much time developing to help our students connect with the concepts? As hard as most of us work to develop these creative, innovative teaching strategies, the last thing we want to happen is that students shut down or they don't participate because of how they feel. One key step on this journey is obtaining factual information about a specific culture or specific biases that we have. So first, we're increasing our awareness. Second of all, we're taking action. So we're learning more about that bias and figuring out how can we mitigate it or at least better manage it to help ensure that we're creating those inclusive learning experiences that we know can make the difference between a student's success and failure. Next is going to be cultural characteristics. If we have diverse student body, which most of us do, we want to think about what are some of those cultural characteristics that I want to be mindful of as it relates to the diversity that I see in my student population. We also want to increase our students' awareness, and oftentimes this is already integrated into our curriculum. So that's a takeaway, that's a homework item, is to take a look at your curriculum. Identify exactly where these concepts show up in your curriculum. Our ability to truly increase our students' awareness of cultural competence, identifying those biases and perhaps stereotypes that they have, is going to allow them to take better care of our patients, right? So it starts with awareness, doing that assessment. Second step is we want to be able to identify some strategies that we can use to mitigate or eliminate that bias or the stereotype that we may have about a certain cultural group. The next question you want to consider is, how do values influence our learning space? Okay, so I want you to take a moment to engage in reflective practice. So just thinking back to the last time maybe there was tension or conflict associated with a cultural stereotype that came up or lack of cultural respect related to someone else's differences or their diversity. So just think back to that moment. And I want you to consider what could have been done differently. How could it have been handled differently? Oftentimes we see with our students a variety of learning styles, a variety of learning preferences. Our students can sometimes be embarrassed or shy to respond to a question, to engage in discussions, because they may have a different learning style than others. Perhaps they're a processor and they are an assimilator, and we haven't given them enough facts, enough information to really help them feel like they are included in the learning process that we develop for them. When we talk about engagement in active learning strategies and how we should engage strategies that are going to connect with all 4 different learning styles, it's more than just about a teaching strategy. It's more about a mindset. It's more about a feeling that our students have. So what can we do? Well, first you want to create, as much as we can, a professional relationship with that student where they understand that we truly do care and that we are here to support their success. The second step you can take is showing students that you're human, being able to establish that rapport where we are following through on what we tell students we're going to do. We are showing up prepared as a faculty member, and we're also taking time to recognize those nonverbal cues. Even for those students that don't speak up, we can often read in their body language when they become disconnected. So that is how our values really can negatively influence the learning space. And then I want to talk about, on the flip side, how can our values actually improve the learning space and learning experiences? So during our monthly boot camp, which is our Faculty Excellence Accelerator, this was a topic that we focused on to help introduce our conversation about simulation and active learning and teaching strategies, and how we can contribute not just to those hands-on experiences in simulation, but also how can we engage in that effective learning domain? How can we have conversations, transparent conversations with our students about how patient care can be negatively affected when we allow the stereotypes that we have in our head, or based on our past experiences, or maybe it's even how we were raised. So how can those stereotypes, those biases, affect patient care? Well, we know the research tells us that people of color are often experiencing not the same level of care as it relates to pain, for one example. Maternal health is another area. We know that people of color do not receive equitable health care. They do not receive equitable attention as it relates to their healthcare needs. So we know we have a lot of work to do in this area, and it starts with us as educators integrating these key concepts into our curriculum, having these transparent conversations, and doing better. So one colleague actually shared that she's of Asian descent, and it was identified that an Asian patient did not want to take a bath. Well, this clinical faculty told their students, they said, oh, wait a minute, that's not part of our culture. I'm actually of Asian descent as well. Let me go talk to this patient. And sure enough, she was able to have a conversation to the point that he was able to share some of his personal thoughts and opinions about taking a bath, and she was able to continue to have the conversation with him and really coach students around from a cultural competence standpoint, how important it is to establish rapport with the patient, to figure out a strategy to help ensure that they're receiving the best care possible. There's always opportunities and experiences for us to increase our knowledge as it relates to what steps we can take to create these coachable moments with our students, and also to not allow them to feel bad about that, but just take it as it is, which is a coachable, teachable moment. So what else is it that you want to focus on? Thinking about how does bias really influence learning? And we know as we explore the assessment components using Chapter 17, that's going to be a great start. Figuring out what are some of those biases that not only we have as faculty, but what about our students? Do we think they have biases? Absolutely. So how can we help them manage those biases so it doesn't negatively affect their learning, especially when it comes to group work? That's where I always think about is group work, because we know students are very diverse, and diversity is more than just about what we see on the outside, whether it's based on ethnicity or age or gender. It's more than just about that. It's about what we don't see. We know that our students are challenged when it comes to socioeconomic elements, when it even comes to level the playing field when we talk about the learning, the social determinants of learning. Our ability to truly understand what these definitions are is a great next step as we think about what can we do to create more inclusive learning experiences for our diverse learners. All right, so let's talk about definitions. Here's the question. What is cultural understanding, knowing sensitivities and skills? And does this really affect patient care? I think we've already established that it absolutely does. You're going to look at page 307 to have an even deeper understanding of these terms, and most importantly, how does it show up in our curriculum? How could it show up in our curriculum? And what are the next steps going to be? So we did include the full APA citation here because we wanted this to be a source that you can go to. Of course, Billings and Halstead is a great resource, and they actually cite this reference as well. The definition of cultural skills is defined as the ability to collect culturally relevant information or data regarding the client's presenting problem and accurately conduct a culturally based physical assessment. This requires, obviously, some accountability and responsibility on our part to take the time, ideally on admission, to get to know the patient's cultural beliefs, maybe some of their social norms, so that we can make the best plan of care possible for this patient. And it's also about communication. When we're engaging in these conversations upon admission, it allows the patient and the family to understand that we see more than just what's on the outside, that we want to know more about what's on the inside. How can we take better care of them during their stay? The second concept and term that we want to understand is cultural awareness. This is defined as the process by which the healthcare professional continually strives to achieve the ability to effectively work and really support the cultural context of that client. So it requires us to take that moment of not only assessing the patient's cultural norms and requests, but also ours. So thinking about doing that self-examination of our own cultural background and biases. The last term is cultural knowledge. So this is the process of seeking and obtaining an educational foundation about diverse cultural and ethnic groups, including their worldviews, health beliefs, and practices. Each of these elements can directly contribute to creating a more inclusive learning environment. So just to recap, what steps should we take? First and foremost is doing that assessment. Where is our cultural competence? And what next steps do we need to take to find the information about the cultures maybe that we don't have a lot of information about? That's going to help us check those biases as well. And then the next step we want to think about is exploring our learning experiences that we're developing for our students. Hopefully we're not continuing to include information about gender, age, or ethnicity in our exams unless it's relevant to answer the question on the exam. Same thing with unfolding case studies. Hopefully we've already taken some essential steps to make sure that we're not including unnecessary bias in the learning experiences that we're developing for our students. So what are some of these inclusive teaching strategies? All right, so now what we're going to do is take a look in Billings and Halstead. This is going to be in a table, which that's what I love about chapter 17. There's so many great tables. Again, we're still in the 6th edition. This is on page 311 in box 17.2. So what are some of those inclusive, culturally inclusive teaching and learning strategies that we can provide in order to create more of the environment where all students feel like they belong? Well, first and foremost is to create these meaningful connections, right? Not the superficial ones. We want to create meaningful relationships and connections with our students, again, on a professional level, but we want them to understand what our values are. And again, we want to focus also on instilling civility and talking about those ground rules within the classroom. Not only talking about the behaviors, but why is it so important? Research continues to tell us that when we don't effectively communicate as a healthcare professional, it will negatively affect the outcome of our patient, and that's not what we want. The next consideration is thinking about sharing information related to our cultural norms and experiences that align with the learning experiences that we are developing with our students. So if we've integrated some of the cultural elements that we should in our curriculum, and most of our accredited bodies are also looking for that, then that's what we want to consider, is sharing some information that is meaningful and appropriately aligned so that students can see us as a human. And also, there's often similarities in our backgrounds with some of our students. And then next, we want to be very intentional as we develop assignments for our students. So we want to be able to connect the learning that's happening in the classroom with the actual hands-on experiences that students are engaged in. Taking a few moments also to debrief with our students about maybe what went well, what didn't go so well, and what they're going to do differently next time. Sometimes when students are engaged in these conversations with patients and there's a situation where a cultural aspect comes up, it can be very uncomfortable. Reassuring our students after they've had this type of situation, just to let them know that we are here to support them, debriefing with them, hopefully also talking about what we could do differently next time, should all be part of the equation when we think about how to best support our students through some challenging situations that may come up related to cultural norms and beliefs. All right, so let's take a look at our thought-provoking question. We didn't forget, we saved it for last in this snapshot. All right, so I'm going to pull it up. So we can take a look at this thought-provoking question. And as I'm pulling it up, I want you to think about what are your next steps going to be. Okay, so this is an opportunity for a transparent moment for you to think about what are your next steps to ensure that you're taking every measure to engage our students in a way that's going to create increased cultural competence and increased inclusive learning where all students feel like they belong. Consider the following patient scenario. A 65-year-old male patient with a history of diabetes and hypertension is admitted to the medical surgical unit with the complaint of chest pain and shortness of breath. As a nurse educator, you are supervising a student nurse who is caring for this patient. In this context, which attributes best identify the nurse educator's nursing experience that can contribute to the student nurse's development of clinical judgment? Describe the steps the nurse educator should take to guide the student nurse in assessing and managing the patient's condition, highlighting the importance of nursing experience in clinical decision making. Number 2, compare and contrast the approaches of the nurse educator and the student nurse in assessing and managing the patient's condition, emphasizing the role of nursing experience in shaping clinical judgment. Or C, explain the theoretical concepts of clinical judgment and nursing experience, illustrating their application relevant to the patient scenario, and discuss how the nurse educator can effectively transmit this knowledge to the student. What you want to look at again is, what is this question really asking you? So first, we're starting with the scenario. The 65-year-old male patient is with a nurse educator who is their supervisor in their student nurse role. So the question is, what is going to be the best approach for this nurse educator to take to support the advancement of clinical judgment? Okay, so those are your 3 options. When you get to the CNE exam, remember that you should expect that there will be a scenario or a statement related to how you are going to answer the question. Okay, so oftentimes, in fact, we know 70 to 80% of the time, it's going to be an application or analysis question. Your ability to truly make a decision about what the best option is going to be aligned with, number 1, our ability to have that experience as part of our learning in the past, because we know experience is our best teacher. So that's what we're drawing from, a prior experience or knowledge from the textbook. All right, so let's see if you chose the correct answer. If you chose A, you are correct. We want to describe the steps the nurse educator should take, because this is the one that is going to allow for interactive teaching strategies where the nurse educator is able to give feedback to help the student understand what the next step should be related to clinical decision making and the rationale. Okay, so that's ultimately the reason, is because it's more associated with application and analysis. Because not only is the nurse educator going to guide the student nurse in assessment and managing the patient's condition, but they're going to talk about the why. Why is it that we want to take this step as it relates to what our clinical practice is going to be? Compare and contrast is not going to be at that level of clinical judgment that we need students to be. So is there value in compare and contrast? Yes. However, we have a situation where the nurse educator can explain the decisions that are made. So this is why when we talk about clinical application, clinical judgment, we want students to have those hands-on experiences. We want to follow that clinical judgment model, put students in a position where they're able to recognize cues as the first step, able to make an assessment, which that's what you see in this actual option number 1, and then decide what steps they should take for intervention, how they manage the patient condition. So that's the other part with A. Even if you're a little confused about, okay, why is this question worded this way? Well, it's because the key is thinking about what is it that we should think about as a nurse educator? How do we think as a nurse educator versus a nurse. So compare and contrast is a great formative experience to help our students from a theoretical standpoint be able to determine what next steps can be. However, we have a real life experience, right? Because that's exactly what it says. It starts out by saying the 65-year-old patient is actually admitted to the med-surg unit and is being taken care of within that unit. So we want to engage in those real life clinical experiences so that students can grow from them. And then C, same thing, explain the theoretical concepts. Well, we're able to have those hands-on experiences, have that interaction, as we just talked about, that is collaborative and in real time to help the student learn. So this again is why A would be the best answer based on the choices that we have. All right, so what I would say is, if you're not sure why A was the best answer, we want you to go back and take a look at some of the key concepts that we talk about as it relates to clinical judgment. So you're going to start with Billings and Halstead. There are several pages on clinical judgment and critical thinking, and that's exactly what you want to think about. What are my steps as a nurse educator to help move my students through this journey so that they can have this increased awareness that we know is essential for them to be able to make safe patient care decisions, recognizing those cues, making decisions about what next steps are going to be, using the SBAR framework, and then determining whether or not that intervention was appropriate, whether or not it created a change for that patient. And next step is going to be making sure that we consider what other options we have for interventions if needed. Or the nursing student or nurse may need to collect more data as well. When you're on the journey to achieve certification, it can become overwhelming very quickly. And it doesn't have to. Using the right resources, having structure as part of your journey are two key steps when you think about how is it that you're going to better manage the process so you can finally get C&E off of your bucket list. It took me almost 8 years, but it doesn't have to take you that long. We look forward to seeing you in our C&E in 60 Days program or in our other programs. And until then, we hope the Snapshot has been helpful, and we'll see you next time. Take care, everybody.